Okay, so I'm here with Marion and Jeff after a really interesting WIHI on the opioid crisis and maternal and newborn health. Marion, what did you learn from the three great examples we heard from the field about this topic?
Yeah, definitely. I thought it was a great show. I think that I have to say, in all of my years working at IHI, this was one of the best examples I've truly seen of the business case for quality and the triple aim in its very essence. Nancy talking about how much money it saves to go upstream and help these women before it results in downstream NICU costs and poor outcomes and costs over the lifespan was just remarkable. And I think that really kind of was driven home for people. It was also interesting how much respect all three women and these three programs had for the women themselves. I thought it was interesting that they mentioned that a lot of times people only care about delivering the healthy baby and taking that baby right away from this woman and forgetting that this woman has experienced a lot of trauma in her life and deserves respect, deserves healing. This is can be a time of great healing if we engage with these people. And so I thought that was a really good reminder about the women and not just the babies that sort of come from this situation.
What would you add to that, Jeff? What things can a listener take away?
Mike, there's just so much here. This is really, truly triple aim work. The risk screening and assessment piece is obviously important. I think that the attention to that really comes from it seeming like a first step. We can't really help the population as a whole unless we know who really needs the help. And I think we heard some debate. We heard a little bit of differences in opinion between the three panelists about the right way to do that. And I think in some ways the jury's still out, but I think the panelists at least offered a number of different approaches. And these programs are pretty cutting edge. I think they're really innovative. And between the three of them, they have good answers to the question also of what's next. You identify a woman who needs integrated care. So what do you do? And, the Project Nurture, you have this really fascinating model. They're not only doing, in some ways, the obvious thing of bringing addiction treatment to the perinatal site of care, they're bringing perinatal care to addiction treatment centers, which is, it's not something everybody can do, but it's just so interesting, and they're seeing some really impressive results. In Dartmouth-Hitchcock, if you're an academic medical center, obviously, you have the resources to bring together addiction treatment with psychiatry, address behavioral health integration, a robust case management approach. They're starting to think about pediatrics to some extent, and they're scaling their approach across a region. So, these programs are answering not only the question of how do you identify the women who need additional services, but what do you do next? And as we saw, these outcomes speak for themselves, as Marion was gesturing toward. Billions of dollars of savings, better outcomes locally, better outcomes longitudinally. In the perinatal care improvement world, this should be a big priority, and I hope that between the three panelists, we learned why.
Great. Thank you guys so much. Great conversation, great discussion. And I thank both of you for your valuable contributions too.